If you or a loved one is considering or already taking Simponi, it's essential to understand the potential side effects and how to minimize them. In this comprehensive guide, we delve into the world of Simponi, a medication used to treat various inflammatory conditions. Simponi is known for its effectiveness in alleviating symptoms and improving the quality of life for patients. However, like any medication, it can come with side effects that need to be monitored and managed. What is Simponi and its uses? Simponi, also known by its generic name golimumab, is a type of medication known as a tumor necrosis factor (TNF) blocker. It works by targeting and inhibiting TNF, a protein in the body that contributes to inflammation. Simponi is commonly prescribed to individuals with rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, and ulcerative colitis. The primary goal of Simponi treatment is to reduce inflammation, alleviate symptoms such as joint pain and stiffness, and slow down the progression of the underlying disease. Simponi can be administered as an injection given either by a healthcare professional or as a self-injection at home. Common side effects of Simponi. While Simponi is generally well tolerated, it can cause certain side effects in some individuals. The most common side effects reported by patients include injection site reactions, upper respiratory tract infections, and headaches. Injection site reactions. It is common for individuals to experience redness, swelling, or pain at the injection site after receiving a Simponi injection. These reactions are usually mild and temporary, resolving on their own within a few days. However, it is important to inform your healthcare provider if the injection site reaction persists or worsens. Upper respiratory tract infections. Simponi can slightly weaken the immune system, making individuals more susceptible to infections. Upper respiratory tract infections, such as the common cold or sinusitis, are among the most frequently reported infections associated with Simponi use. If you experience symptoms such as a sore throat, runny nose, or cough while taking Simponi, it is advisable to consult your healthcare provider. Headaches. Headaches are another common side effect of Simponi. These headaches are typically mild to moderate in intensity and may occur at the beginning of treatment. If headaches persist or become severe, it is important to seek medical attention to ensure proper evaluation and management. Serious side effects of Simponi. While rare, Simponi can also cause more severe side effects that require immediate medical attention. These serious side effects include infections. As mentioned earlier, Simponi can suppress the immune system, increasing the risk of infections. However, in some cases, these infections can be severe and require prompt treatment. It is crucial to be vigilant for signs of infection, such as fever, chills, persistent cough, or unusual discharge, and seek medical attention if these symptoms occur. Allergic reactions. Some individuals may develop allergic reactions to Simponi, although this is uncommon. Signs of an allergic reaction may include hives, difficulty breathing, swelling of the face, lips, tongue, or throat. If you experience these symptoms after receiving Simponi, it is important to seek immediate medical help. Liver problems. In rare cases, Simponi can affect liver function, leading to liver problems. Signs of liver problems may include yellowing of the skin or eyes, dark urine, pale stools, persistent nausea, or abdominal pain. If you notice any of these symptoms, it is crucial to contact your healthcare provider promptly. Heart failure. Although rare, Simponi has been associated with an increased risk of heart failure in some individuals. Symptoms of heart failure may include shortness of breath, swelling of the legs, rapid weight gain, and fatigue. If you experience any of these symptoms while taking Simponi, it is important to seek medical attention immediately. Factors that can increase the risk of side effects. Several factors can increase the likelihood of experiencing side effects while taking Simponi. It is essential to be aware of these factors to better understand your individual risk profile and take appropriate precautions. The factors that can increase the risk of side effects include concurrent medications. Certain medications, such as other immunosuppressants or live vaccines, can interact with Simponi and increase the risk of side effects. It is crucial to inform your healthcare provider about all the medications you are taking to ensure safe and effective treatment. Medical history. Individuals with a history of infections, liver problems, heart disease, or other pre-existing conditions may be at a higher risk of experiencing side effects while taking Simponi. It is important to discuss your medical history with your healthcare provider before starting Simponi treatment. Age and gender. While Simponi can be prescribed to individuals of different ages and genders, it is important to note that the risk of side effects may vary. For example, older individuals and females may be more susceptible to certain side effects. Your healthcare provider can provide personalized guidance based on your age and gender. Tips for minimizing Simponi side effects. Although it is not possible to completely eliminate the risk of side effects, there are steps you can take to minimize their occurrence and manage them effectively. Here are some practical tips. Follow the prescribed dosage and schedule. It is crucial to take Simponi exactly as prescribed by your healthcare provider. Do not skip or alter the dosage without consulting them first. Following the prescribed schedule ensures optimal effectiveness while minimizing the risk of side effects. Proper injection technique. If you are self-administering Simponi injections at home, it is essential to learn and follow the correct injection technique. This includes proper hand hygiene, selecting appropriate injection sites, and ensuring the medication is administered at the right depth and angle. Your healthcare provider or nurse can provide detailed instructions on the injection technique. Monitor for signs of infection. As Simponi can slightly weaken the immune system, it is important to be vigilant for signs of infection. This includes regularly checking your body temperature, observing for any changes in your overall well-being, and promptly reporting any symptoms of infection to your healthcare provider. Maintain good overall health. Leading a healthy lifestyle can contribute to minimizing the risk of side effects while taking Simponi. This includes eating a balanced diet, engaging in regular physical activity, getting adequate rest and sleep, and managing stress levels. Maintaining good overall health can support your immune system and reduce the likelihood of experiencing side effects. Stay informed and communicate with your healthcare provider. Keep yourself updated on the latest information about Simponi and its potential side effects. Regularly communicate with your healthcare provider, sharing any concerns or questions you may have. They can provide personalized advice and address any specific concerns related to your treatment. Alternative treatments for Simponi. While Simponi is an effective medication for many individuals, it may not be suitable for everyone or may not provide the desired results. In such cases, alternative treatments may be considered. The choice of alternative treatment depends on various factors, including the specific disease being treated, individual preferences, and medical history. Some alternative treatments that may be considered include other TNF blockers. If Simponi is not well tolerated or ineffective, other TNF blockers such as adalimumab or infliximab may be prescribed. These medications work in a similar way to Simponi and can be effective for certain individuals. Non-TNF inhibitors. Non-TNF inhibitors, such as ustekinumab or secukinumab, target different proteins involved in inflammation and may be suitable alternatives for individuals who do not respond well to TNF blockers. Conventional disease-modifying antirheumatic drugs, DMARDs. In some cases, conventional DMARDs such as methotrexate or sulfasalazine may be prescribed as an alternative to Simponi. These medications can help reduce inflammation and manage symptoms. It is important to discuss your treatment options with your healthcare provider, who can provide personalized guidance based on your specific condition and needs. Talking to your doctor about Simponi side effects. Open and honest communication with your healthcare provider is essential when it comes to managing Simponi side effects. Here are some tips to help you have productive conversations about side effects. Be prepared. Before your appointment, take some time to reflect on your experiences with Simponi and any side effects you may have noticed. Write down any questions or concerns you have, as this will help ensure you cover all the necessary topics during your appointment. Describe your symptoms. When discussing side effects with your healthcare provider, be specific and detailed in describing your symptoms. Provide information about the duration, intensity, and frequency of the side effects. This will assist your healthcare provider in making an accurate assessment and determining the appropriate course of action. Ask about management strategies. Inquire about strategies to manage or alleviate specific side effects you may be experiencing. Your healthcare provider can provide guidance on lifestyle modifications, over-the-counter remedies, or prescription medications to help manage these side effects effectively. Discuss alternative treatment options. If you find the side effects of Simponi to be intolerable or if the medication is not providing the desired results, discuss alternative treatment options with your healthcare provider. They can evaluate your individual situation and provide recommendations based on your specific needs. Remember, your healthcare provider is there to support you throughout your treatment journey and ensure your well-being. How to report Simponi side effects. Reporting any side effects you experience while taking Simponi is crucial for monitoring the safety and effectiveness of the medication. By reporting side effects, you contribute to the ongoing evaluation and improvement of Simponi's safety profile. Here are the steps to report Simponi side effects. Contact your healthcare provider. The first step is to inform your healthcare provider about the side effects you are experiencing. They can document your symptoms and provide appropriate guidance on further actions. Report to the regulatory authority. In many countries, regulatory authorities have systems in place to collect information on side effects of medications. Contact your local regulatory authority or visit their website to learn how to report side effects. This information is crucial in ensuring the ongoing safety monitoring of Simponi. Contact the manufacturer. Some pharmaceutical companies have dedicated channels for reporting side effects directly to them. Visit the manufacturer's website or contact their customer service to inquire about the process for reporting side effects. By reporting side effects, you contribute to the collective knowledge about Simponi and help ensure the safety of future patients. Legal considerations for Simponi side effects. In rare cases, individuals may experience severe side effects from Simponi that result in significant harm or complications. In such situations, it may be necessary to seek legal advice to understand your rights and explore potential avenues for compensation. Here are some legal considerations to keep in mind. Product liability. If you believe that Simponi's side effects were not adequately disclosed or that the medication was defective, you may have a product liability claim against the manufacturer. Consult with a qualified attorney specializing in product liability to evaluate the merits of your case. Medical malpractice. In some instances, healthcare providers may have failed to properly monitor or manage Simponi side effects, leading to harm. If you suspect medical negligence, consult with a medical malpractice attorney to understand your options. Statute of limitations. It is important to be aware of the statute of limitations for filing a legal claim related to Simponi side effects. The statute of limitations varies by jurisdiction and the nature of the claim. Consult with an attorney to ensure you comply with the necessary deadlines. Remember, legal considerations should be discussed with a qualified attorney who can provide personalized advice based on your specific circumstances. Conclusion: taking control of your Simponi treatment. Simponi is a valuable medication for individuals with various inflammatory conditions, providing relief and improving quality of life. However, it is important to be aware of the potential side effects and take steps to minimize their occurrence and manage them effectively. By understanding the common and serious side effects of Simponi, recognizing factors that can increase the risk of side effects, and implementing practical tips for minimizing them, you can take control of your Simponi treatment journey. Remember to maintain open communication with your healthcare provider, report any side effects promptly, and consider alternative treatment options if necessary. By staying informed and empowered, you can navigate the world of Simponi with confidence, ensuring a safe and effective treatment experience. Thanks for watching.